Hi! Welcome po to our another series of videos on pregnancy in the new normal. For this video po, I will be discussing on the prenatal care in this time of the pandemic. So stay tuned for that. Sa ngayon po, ang prenatal care is modified to reduce the risk of infection by not exposing our pregnant women unnecessarily sa mga healthcare facilities. Because diba nabanggit ko sa previous video, once infected ang pregnant woman, yung risk for severe or grabing COVID illness is higher. So yung risk na ma-hospital, ma-admit sa ICU, meron. Which could lead to mga adverse pregnancy outcomes such as preterm delivery. So, hindi rin yung okay sa baby yun. So, ngayon, ang OB community came up with the general guidelines. General guidelines meaning nag-a-apply sa mga non-problematic women. Pag nasa high-risk pregnancy category ka, like for example, with hypertension, asthma, diabetes, or mga sakit sa puso, pwede mag-deviate from these guidelines. So, ang prenatal check-ups before COVID, mas madalas kesa ngayon. Dati, kung once nalaman na buntis, pupunta agad for walk-in check-up sa OB, and then magpapatest na agad ng mga ultrasound and laboratories. Ngayon, hindi po. At kung dati, ang check-up from the time na nalaman mo is monthly hanggang mga 7 months or 28 weeks ka. And from 28 weeks, every 2 weeks hanggang 36 weeks and then weekly from 37 weeks hanggang mga anak ka. Ngayon, hindi po. Actually, nangalahati almost ang prenatal check-up with their OBs ngayong time of the pandemic. So in general, ang consultation ngayon is a combination of face-to-face with your OB and telemedicine. Pag nalaman mo, once pregnant ka, syempre inform mo agad ang OB mo. And then magbibigay siya ng mga instructions sa'yo. Usually, ang sasabihin niya, pag wala ka namang problems like bleeding or pelvic pain at that time na nalaman mo na buntis ka, ang advice sa'yo is usually ultrasound, baseline ultrasound, and initial lab tests at 11 to 13 weeks. So, para ma-date yung pregnancy, malaman yung edad ng baby, malaman yung location kung okay lang, and kung may ibang problem like bleeding sa loob. Importante din po ang ultrasound at 11 to 13 weeks kasi meron pong gustong finding na makita ang OB nyo kung may possibility of a Down syndrome sa baby. Pero ang earlier ultrasound may be done kung sa palagay ng OB nyo kailangan, like when you present with vaginal bleeding or spotting and pelvic pain or masakit ang puson. So kung dati, pre-COVID, merong check-up between 4 and 5 months para i-check yung gender on ultrasound, ngayon, hindi ho kasama yan sa minimum requirement. Kasi, from 11 to 13 weeks na check, magja-jump po sa 20 to 24 weeks. Kung saan, ito yung mas importanteng gagawin sa inyo. Pwedeng may face-to-face kasi magre-request ang OB nyo for a congenital anomaly scan or fetal anatomic survey kung saan tinitingnan kung may mga anomalies ba sa bata. So yun, very important yung part na yan ng prenatal check-up. So, around 24 weeks naman, pwedeng mag-check ng another lab test like sugar test yung OB nyo. So ginagawa to anytime from 24 to 28 weeks. At 28 weeks naman, pwedeng may face-to-face ulit with your OB kasi yun yung time na mag-administer siya ng vaccine sa inyo and magre-request kung meron pa siyang ibang kailangan na laboratories. So at 32 weeks or 8 months, pwedeng bigyan lang kayo ng request via telemedicine for an ultrasound para i-check yung laki ng baby, yung panubigan niya, yung pwesto ng baby sa loob. Pag may problem at sa palagay ng OB kailangan yung makita, pwede rin may face-to-face that time. At 36 weeks naman, or a week before yung kabuwanan nyo na, pwedeng may face-to-face depende kung saang healthcare facility kayo nagpapa-check up. Kasi may gagawing procedure ang OB sa inyo kung saan meron siyang kukunin sample sa puwerta to check for a type of bacteria. Pati yung HIV that time is ginagawa din. So, pag dating nyo ng 37 weeks hanggat manganak kayo, pwedeng via telemedicine na lang yun every week. Basta, guided kayo ng mga kailangan yung bantayan. Like yung fetal kicks, yung fetal movements, contractions, vaginal bleeding, and watery vaginal discharge. So, mamaya po, magdedetalye tayo on it. So, ngayon po, before ang face-to-face with your OB or sa any healthcare facility, usually preceded yan with a telemedicine para po guided kayo kung ano na yung gagawin nyo. During the Tele Consultation po, make sure sabihin nyo na po lahat ng concerns nyo sa OB nyo para po lahat ng talking mangyayari during the telemedicine. Tapos kung bigyan niya kayo ng instruction for a face-to-face, magpo-proceed na lang agad dun sa procedure kung meron siyang kailangan gawin sa inyo. During the Tele Consultation din po, pag meron kayong possible signs and symptoms of COVID illness, i-report nyo rin po yan, importante, sa OB nyo para makategorize na kayo kung mild, moderate, or severe para ma-advise na kayo agad kung kailangan nyo pumunta ng healthcare facility or stay at home lang naman, tapos i-delay na lang ang face-to-face. Kung ang next instruction sa inyo is to go to the ER, ang usually nangyayari po doon is pwedeng mag-request sa inyo ng rapid test. Pwede rin mag-require sa inyo ng clearance from the infectious disease specialist. Minsan kakailanganin pang ma-x-ray. Don't worry, yung x-ray may takip naman po yung tiyan. And mga blood tests kung kailangan. Pero halimbawa, during face-to-face, as with any other establishments, same po yung sa clinic and hospital, yung mga protocols, yung mga safety health protocols. So ngayon po, lahat ng konsulta at visit sa healthcare facilities are by appointment and by scheduling. Ideally, wala pong overlap ng patients in the clinic or in the lab, or meron lang certain number of patients in a certain area to minimize, again, transmission and exposure. So, kung dati po, kasama nyo yung asawa nyo or yung nanay nyo, mother-in-law nyo during check-up, ngayon, hindi po yun encouraged. Or kung dati, naghihintay kayo ng matagal dun sa waiting area for check-up at nakikipag-usap sa mga katabi niyong pasyente, ngayon, discouraged yun, syempre. So, yan po yung general picture of how the prenatal check-ups are being conducted. Sa susunod ko naman pong video, I will give tips sa mga pregnant patients natin sa kung anong pwedeng gawin nila habang nasa bahay po sila. Thank you for watching! Hope you learned something from this video. If there are any other topics that you want to discuss here, comment down below. And please subscribe to this channel so you get updated with my latest videos. See you!